it will take 200 years of Nigerian healthcare spending to accumulatively reach 1 year of UK healthcare spending. The most shocking thing is that the entire healthcare budget for Nigeria is less than half of Guy's and St. Thomas. That is a government hospital in the United Kingdom. It's less than half of just one hospital, the entire budget. Do you know that that is the hospital that most of our elites in Nigeria go to? Wait, are we even joking, yeah?
You get it?
Okay.
If you don't get it, forget about it.
Nigeria budgets 1,564 Naira per citizen for healthcare. That is less than $5. Let me explain more with some shocking data. Wait, somebody wake me up from my slumber. That means the United Kingdom spend almost close to half of our gross domestic product per year on just healthcare. Wait, hold on, my friend. When I say I want to expose something about the healthcare system in Nigeria, I wasn't joking. In 2001, the African Union met at Abuja, Nigeria. That's comprising of heads of state and president of various countries in Africa. What they concluded in that meeting was to allocate 15% of their national budget to healthcare. Wait, this commitment has been over 20 years and Nigeria is not being able to meet up with half of the 15%. Alright, let's not go to the 15%. What about meeting up with 5%? I'm talking about 5% of the national budget. Wait a second, can you do me a favor? Please hit the like button and subscribe to the YouTube channel. Yo, it's time to show you some scary figures concerning healthcare in Nigeria. Do you know the national budget for health in Nigeria 2022 is sitting at 724 billion naira. That is 4.2% of the national budget. Neither the 15% that was supposed to be allocated for health. We are not even talking about half of that 15%. But every year we are only seeing 4%. The highest we have seen is 5%, if my memory serves me right. Alright, so here is the scary part. Do you know, going by the approved budget of 724 billion naira, that is 4.2% of the national budget. Do you know each citizen is entitled to 1,564 naira? Alright, so anytime I think of this or I see this figure, my head wants to go. That means each individual in Nigeria is just entitled to less than $5. Do you know this calculation is excluding buying of medical equipment, drugs, and funding for key sectors in Nigeria, like family planning, mother and child, and some other notable sectors in Nigeria. Let's not dabble into that. This is just a calculation for each citizen in Nigeria. In the United States of America, each citizen is entitled to, you see it for yourself, you can check for other countries. At this moment, we really need to talk about healthcare financing in Nigeria. And this data I'm about to show you, it's going to blow your mind. Do you know Nigerian GDP is sitting at $500 billion? Nigeria healthcare spending is roughly about $1.6 billion. Do you know the United Kingdom spend over $200 billion each year for their healthcare system? That means it will take us 200 years to accumulatively spend what the UK is spending per year. It's shocking, right? And do you know we aren't talking about the funding of the budget, that's the national budget, because in Nigeria, most of the time that they dabble into budget issue, we haven't even gotten half of our budget. All right, let's not talk about this budget of a thing again. Let's talk about the brain drain in the healthcare system, as some people popularly call it, Japa, which is finding a better life in a more developed country. The brain drain in the Nigerian healthcare system is too much. Let me pull out some data for you so that you understand what I'm talking about. Nigeria needs about 363,000 medical doctors, and Nigeria only have 24,000 licensed medical doctors. I'm talking about licensed medical doctors. I'm not talking about quacks though. And do you know Nigeria has produced 4 times of the number that it needs to function optimally? That's to achieve essential health care. That's 363,000 medical doctors. If you calculate it, close to 1.5 million licensed medical doctors. So where are they? Okay, by now you should know where they are. Japa. According to WHO, that is the World Health Organization, a country is supposed to have a mix of 23 doctors, nurses, and midwives per 10,000 population to meet essential health care. Going by the 24,000 licensed practicing medical doctors in Nigeria, that means the doctor to patient ratio is sitting at 1:9. That is a doctor to slightly above 9,000 patients, but according to WHO recommendation, is supposed to be 1 doctor to 600 patients. A report by the United Kingdom Nursing and Midwifery Council reveals that as at March 2022, the number of Nigerian trained nurses presently in the UK permanent register rose from 2,796 in 2008 to 7,256 in March 2022. That is within a period of roughly 4 years, and it's still counting. And we haven't even talked about other countries like Canada, Australia, United States of America, with over 2,000 to 3,000 patients attached to one nurse. This is becoming so serious to the extent that well over 7,000 nurses left Nigeria 2021. Just 2021 alone, over 7,000 nurses left the country. And with the mass exodus of nurses and doctors in Nigeria to search for greener pastures, I really don't blame them though. The brain drain is serious to the extent that the wealthy ones in Nigeria rather seek for medical attention abroad, and this has cost Nigeria billions of dollars over the years. Alright, so this is just me thinking aloud. If you run a survey about relocating abroad to places like United States of America, United Kingdom, Canada, Australia, and some other countries, if you have 10 people on your research list, I believe 9 people are going to say yes. Mind you, if you are a doctor or a nurse watching this video, leave me a comment below if you are going to relocate or not. Mind you, if you're not a health personnel, don't worry, just leave me a comment below if you want to japa like other people, because everybody in this country, and not everybody though, like most of the people want to japa to other country, you know what I'm saying, right? So just drop me a comment and give me a like on this video if you want to relocate to other country. By now you should be well aware of why people are relocating abroad to go and work. Good salary structure since they can't find it in their country, good infrastructure since they can't see it in their country, and even the common thing that people are supposed to have, basic social amenities like electricity, water. And I know some people that are watching this video also have the mind to japa. If you're that one, leave me a comment video and like this video. Nigeria has lost about 9,000 trained medical doctors to UK, United States of America and Canada in just 2 years. Do you know Nigeria has lost 57,000 nurses in 5 years to other nations? And this figure is making my head to bust.
Why, Dada? Why?
This is business.
Wait, let's talk a bit about infrastructure in the healthcare system in Nigeria. And I know you will see things like, but let's not dabble into that. Do you know having good infrastructure and adequate medical supply is as important as having that good medical doctor that you think of? Alright, let me give you a backstory. Do you know if you post a experienced medical doctor to a village to work for some years and a patient came to him in that facility, and after his assessment he diagnosed the patient as having respiratory distress, and if a patient is having a respiratory distress, you need oxygen to ease that down. The patient literally needs oxygen and the hospital does not have oxygen. What's the doctor going to do? Literally his hands are tied. He literally can't do anything because it's not magic, it's medicine. And if God doesn't save that patient, he might give up. Talking about salaries in the healthcare industry in Nigeria, we are not talking about them being grossly underpaid. Then in some scenario we have to also deal with non-payment of salaries, and it's not just for 1 month, sometimes it's running up to 6 months. Alright, let me give you some figures. Do you know the nurse in most private settings in Nigeria earn as low as $60 to $100 for the whole month? And a doctor goes home with $200 to $270 for the whole month. A newly employed doctor in most states, the salary structure is within the range of $500 to $600 with all those hours of work. And a newly employed nurse in most states in Nigeria, the salary is within the range of $200 to $250. This is in the government setting. Let me shock you. There is a leave allowance that a senator is entitled to. It's more than what a doctor earns. No wonder doctors, nurses, and other allied health personnel are leaving the country. At this point, you will agree with me that the healthcare system in Nigeria is degenerating every day and every other day. The World Health Organization ranked healthcare in Nigeria as the 4th worst in the world. I'm not talking about Africa. I mean in the world. Nigeria is the 4th worst. That means so many African countries are ahead of us when it comes to healthcare. But let's not dabble into that. The most reasonable thing to do in emergent situation is to call emergency line. Each country has their own unique emergency number to call. In the case of United States of America, if my memory serves me right, I think it's 911, and you get emergent response. That's emergency team are always there to attend to you. But in the case of Nigeria, the reverse is the case. Why is it that the number is there? What's the reason of calling emergency line when you know there will be no emergency response team to attend to you? It makes no sense. For over a decade, the healthcare system in Nigeria is grossly underfunded, poor infrastructure, poor salary structures, and inadequate and poor medical supplies, and the list goes on and on. And yet, the wealthy ones and some leaders of this nation, Nigeria, jet off to abroad for medical tourism. It's not a surprise to so many citizens of Nigeria. It's not only in the health sector. We've also seen that in the educational sector, where students had to stay in their house for 8 months. That is close to a year. And the funny thing is that most of the leaders that are in charge of all these parastatals, their children were abroad schooling. So you've seen it yourself. It's not only in the health sector, it's also happening in other sectors in Nigeria. Thank you for sticking around. Give me a like on this video, subscribe to the YouTube channel, and I'm smart, definitely going to see you on the next one. Peace out.